Dr. Kenyon, welcome to this roundtable discussion.
Thank you, Emily. Thank you for having me.
Great. All right, we're going to go ahead and get started. So for those in our audience who are unfamiliar with PEPFAR, can you give a brief description of the history of the program and what type of programs are funded through PEPFAR?
Yeah, Emily, I think it's really important to understand where PEPFAR fit in to the HIV epidemic. It didn't happen overnight, of course. It was a result of President Bush's State of the Union address in February 2003. And then it took off the following year as legislation and appropriation and all that took place. But HIV was first discovered in 1981. So that was 22 years before PEPFAR. And there was a long trajectory. So there was really a buildup, I think, to something as astounding, and PEPFAR is astounding in terms of size and comprehensiveness. In the late 80s, we started seeing, I was a clinician, a pediatrician in Southern Africa, working in a hospital. And we began to see these children with illnesses that just wouldn't get better. And ultimately they would die, unfortunately, on a very, very high level. And of course, then we would see their mothers also fall ill. And of course, in retrospect, this was the emergence of HIV, which found its way in Central Africa and marched down to Southern Africa, where I was based. And that became really the hyper epidemic area over the ensuing decades. We had nothing to deal with this. So HIV was discovered in 81. We didn't even get blood screening in my hospital until 88. So for 7 or more years, we were transfusing contaminated blood. And there's many other examples of how slow the tools that we have and have now, which are wonderful, we didn't have then, rolled out. And so that allowed the epidemic to take place and settle in and just mushroom into this massive, I call it epidemics, because it's not one epidemic. You have, like I just described, the epidemic of contaminated blood. That's been resolved. We had the unsafe injections. That's been resolved. We had mother-to-child transmission. Many countries have now stopped mother-to-child transmission, and that's something I'm very proud to see our partners achieve, because that's entirely preventable. We have the epidemic of men who have sex with men. We have IV drug users, and so it's a bunch of epidemics that add up to this global epidemic. In 99, President Clinton launched the Life Initiative. I was back in Botswana at this point studying TV HIV epidemiology. And that was the first time CDC was given the green light to be involved. We had basically worked as a subcontractor to AID up until that time, but clearly officials were seeing that this is not going in the right direction. And that's when we got to expand testing. The following year or two, I was fortunate to be visited by Secretary Thompson and Tony Fauci in Botswana to demonstrate what we were doing. And that visit was a lot about mother-to-child transmission. So, and now we're getting into the Bush administration. So that ended up launching the PMDCT initiative, or the Prevention of Mother-to-Child Transmission Initiative, which was the first time we really got to use antiretrovirals. Antiretrovirals, of course, we had them in the United States for decades, but we made a lot of mistakes in treatment here, and it had a lot of resistance issues. In 1996, highly active antiretroviral therapy was first published, ART as we call it now. And so we had the knowledge in 96 to how to treat this effectively using a combination regimen. Single drugs, no, that creates resistance. So lots of effort to set that up. And so you can see how this was rolling out very slowly. And indeed, we had tens of millions of deaths, we had 10 million orphans going into PEPFAR. And we only had 55,000 people on treatment, yet we had tens of millions to treat. So PEPFAR came at the right time. Yes, late for a lot of people, But we didn't have consensus. We didn't have in Congress. And HIV was actually an issue for some of immorality. And so we had members of Congress who wouldn't support a global effort, wouldn't support domestic efforts because of this stigma and discrimination that men who have sex with men and intravenous drug users in particular, but others too, suffer. So it wasn't a priority. But then, there was much more of a social movement, much more activism. We had Bono, who was very vocal and very active in the diplomacy piece, explaining how this was, killing families, killing economies, affecting, the general population. And he went around the United States and actually made a campaign on this. What ultimately pushed Congress was when Jesse Helms, who had been the head of the Foreign Relations Committee, which is the most powerful committee in Congress around appropriations, came around. He had been very vocal about the immorality of HIV, which is itself wrong and very tragic. But he came around with the help of Bill Frist, who was a member of Congress as well, a physician, and Bono, very unlikely group. But that sent a signal to the conservative Christian sector, caring Christians, of course, who felt something more needed to be done. So that's, sorry about the long story, but I think it's important for your audience to know that helps to make PEPFAR very unique because it had this build up and consensus built around a very huge tragedy. It was all over the TV screens. Nelson Mandela gave his memorable speech. I was there in Durban at the 2000 International AIDS Conference. Everyone was in tears. But everyone was really motivated to go back and start treatment. So by that time, I had been assigned to Namibia by CDC, and I was a technical advisor in the Ministry of Health. So I'm going to Ministry of Health meetings. I'm sitting on Ministry of Health committees. I'm writing Ministry of Health guidelines. But we had very few drugs. we only had the green light to treat 500 people. Yet we had a prevalence of 20, 25%, where some communities, over 50% of women in their 30s were infected. So, and the deaths were so visible. We couldn't walk out of our neighborhood without running into a funeral procession. Everyone we knew was losing somebody. Members of parliament were losing people. It was just death everywhere. Very discouraging, but yet now we have the green light with PEPFAR to get serious about treatment and other aspects. Remember, the prevention, care, and treatment are the three legs of the stool around HIV. Prevention of utmost importance. We didn't know then what we know now about the power of antiretroviral therapy in preventing HIV. That came later. So all this is built up slowly but surely. Science was still evolving. I can remember I said we had no testing in 87. I got to Botswana in the late 90s. We only still had the venipuncture test. We didn't even have the rapid test. We were seeing prototypes from lab manufacturers that would come to our CDC team and want to evaluate them, and which we did. Very impressed with the performance, but markets move very slowly, and that has, for your audience, huge policy implications and needs policy decisions to speed that up. We saw progress during COVID. Things moved much faster, but it was a very different epidemic. We could talk about it separately.
Yeah, so